news. Now, as we continue on NTV at 1, renowned Pan-Africanist Professor P.L.O Lumumba has called on government to activate the HIV AIDS Trust Fund to end reliance on dwindling funding from development partners. Professor Lumumba was keynote speaker at the closure of a 3-day HIV AIDS symposium at Makerere University Business School in Kampala. The country's HIV funding deficit stands at 450 billion shillings, according to Uganda AIDS Commission. Here are the details.
Of the president, and my understanding of it is that the presidency in this country has recognized that the impact of HIV/AIDS is not only in the health sector, and that it has an impact of an economic kind, it has an impact of a political kind, it has an impact of a social kind, and that therefore the president is saying, I want to have a bird's eye view of this particular scourge and give it the kind of prominence that it deserves so that we are able to fight it. And that is what begs and legitimizes the conversation that we are engaged in this morning. How do we deal with the question of funding? But before I come to funding, I was talking about the regional perspective of it, because funding must also have a regional perspective. I've already mentioned the Abuja Declaration on how we made commitments to ensure that 15% of our budgets are dedicated to the health sector, and therefore by extension HIV/AIDS would also be on radar. What about in the African arena? Many of us are familiar with the African Health Strategy. If you look at the Africa Health Strategy, it tells us that the current version of it, I think, is between the year 2016 and 2030. And the whole idea is that we want and have devised strategies that are going to ensure that we reduce the disease burden. Because if we reduce the disease burden, then we are releasing funds which could then be deployed in other areas which would improve the quality of our people's lives. And if the continental idea and the continental strategy is therefore to ensure that we improve the health sector, what are the structures that are there which are also relevant to the funding arena? Those of you who are doctors will know that we now have centers for disease control, with the mother center based in Addis Ababa, Ethiopia. The rest are distributed. I think one is in Nigeria, the other one in Kenya, the other one is